you know, one thing that's really important to me, Dr. Andrade, you know, I'm sort of, while I am a patient, I have kind of a unique relationship with a lot of doctors now because of the platform that I'm on and the fact that I'm speaking to so many of them. I've developed some really, you know, I would say friendships with a lot of physicians. And so I can see things now from a little bit of a different perspective than I could before I started doing this. Whereas I know a lot of patients are cynical. They've had a lot of negative experiences with physicians. And so they tend to fall into that thinking of, well, it's all about money. Anytime something is going on and it's negative, it's all about money. And I'm seeing that that's not always the case, especially with, you know, particularly with the providers that I've met and interviewed for the last 2.5 years, is that there's a lot more at play than just money.
Yes.
Does that make sense?
Yes, it makes sense.
Mm-hmm.
It makes sense. Again, I cannot underestimate the relationship of the patient with the doctor is super important. And there's different personalities on the doctors. I mean, we
Mm-hmm.
can't deny that.
Mm-hmm.
But it's very important the doctor has to have empathy with the patient and explain in details the negative and the positive effects of every single procedure or treatment that they have available.
Mm-hmm.
And the empathy to say, hey, listen, I've done only 3 cases, and you're going to be my 4th case. Would you mind? Let me tell you that, but that doesn't happen.
Mm-hmm.
And I'm seeing that more and more because with this trend that they just discovered the laser and the radiofrequency ablation, some companies are selling the product to new doctors that they don't have experience, and the doctors are telling the patient, listen, I have this, come in. And the patient doesn't ask the question, for how long you have been doing this,
Mm-hmm.
how many cases you have done, how many complications you have of success, of failures. And that is something that we need to do something, and something that we have an association that is the National Association of Interventional Endocrinologists of America,
Mm-hmm.
and we're planning to do or put a certification for the doctors.
Mm-hmm.
And so, meaning that if you have the certification, you're able to pursue and the insurance is going to pay you, versus if you don't have the certification, maybe the insurance is not going to be able to pay you. The way that we had before with the ultrasounds, now I see many endocrinologists doing ultrasounds, but do they have a certification? There is something that it was called the ECNO certification, that I have it. But many doctors, they don't have it, and they do ultrasound. So we need maybe in the future to have some sort of certifications for the doctors, and the patients can look when they're going to do a procedure, is this doctor certified or not? Like a board certification. The
Right.
patients, they always look for board certification. So if they're going to have a thyroid ablation, they can know if the doctor is certified to pursue the procedure.
I think that's a fantastic idea, and I'm really glad to know that y'all are trying to do that. How soon do you think that's going to happen?
Maybe in a year, I
Uh-huh.
would say.
Mm-hmm.
Yes. So we're working right now in the statements. It's going to take us a while,
Mm-hmm.
but we're going to do it. The association is going to present in San Diego in May. We're going to have a meeting, and we're going to have all the members of the association to talk and discuss about all these issues.
Mm-hmm. That's wonderful that you are thinking ahead like that. And because these are things that I think a lot of patients over the last 2-3 years have really not, as you said, they haven't thought to ask the questions. And so many of us, myself included at the time when I needed treatment, are desperate to find someone that's close enough to us that we can travel to have this done, because it's often not available locally. I'm very, very thankful that the number of providers is growing, and that it's becoming more common. But as you said, as it becomes more common, we are going to have a lot of times where a provider isn't experienced, and we don't want patients to necessarily be, I don't want to say
correct.
guinea pigs, but
Yeah.
but we
So
don't want.
so the number of procedures that we're thinking for the doctor to be certified is anywhere between 10 to 30 cases.
Mhm.
And to be proficient has to be more than 50 cases.
Mhm. Okay.
So that's where we're thinking right now.
Mhm. And you said this is the NASOIE organization. Would this
Exactly.
only be for endocrinologists?
Yes.
Okay.
That's yes. That is going to be only for endocrinologists.
Mhm. I think that there's another organization called NASIT.
Yes.
And
That's
I
for
wonder,
certain. Yeah, go ahead. I'm sorry.
I was just gonna say, I wonder if they're doing the same thing. I would really be interested to know that. I need to find out.
Yeah, I don't know.
Mhm.
But all the associations are doing a very good job in
Mhm.
the sense of teaching
Yes.
and trying to make people aware of these procedures.
Mhm.